So again, we come with a very important term, which is the patient-centeredness. So the patient-centeredness is a coin of two double faces. One, it's about shared, informed decision-making. Whenever I talk about the patient-centeredness, is the patient involved in the decision-making process, or is he only a passive recipient, that he is not, his ideas or his opinion about his treatment is not taken in consideration? So from where we should start? Maybe we should start from the quality. If I will offer, because we always talk about giving the patient quality product, safe, efficacious, yes? So it all starts about quality, and if we go and define the quality comes in those 9 points, and the most important number 1 is respect for patient values. So if we do not respect the patient, then truly respect him when we truly involve him. Then the patient preferences, patient information, communication and education, emotional support. All these come with patient-centeredness and patient involvement in the decision-making process. So it's about the information. So again, the quality comes with patient-centeredness as an integral part that correlates with each other. So if we go to the patient-centeredness, what is its definition? It's providing care that is respectful and representative to individual patient preferences, needs, and value, and ensuring that the patient value guide all clinical decisions. When we talk about patient satisfaction is a different thing. It's about the expectations of the patient. So if the expectations of the patients are low, he will be satisfied even if he's not getting the full value that he deserves. So if I measure patient satisfaction, I might not get a good measurement of patient-centeredness product. This is very important for the measuring the process. And then come, of course, if the patient right in the core of the decision, if the patient expectations are high enough to demand a good quality health care, then I will get an empowered patient. A patient who is empowered, who is controlling his health, and who is engaged in his health management. So if I go to the empowerment, its empowerment is defined as the educational process designed to help patients develop the knowledge, skills, attitudes, and degree of self-awareness necessary to effectively assume responsibility for their health-related decisions. So this is the empowerment of the patient. It's about giving him information, it's about giving him skills, it's about giving him the decision so he can be responsible for it, but so he can be engaged. So the 4 pillars of empowerment is the awareness, freedom, choice, and then responsibility. Everyone now is asking me, where's the pharma role in all of this? So for patient-centric, I'll have empowered patients. They make informed decision-making. They are engaged. Of course, if the patient is engaged, his clinical outcomes will be improved. And on the long term, he will be satisfied. While profit-saving centric system, we will have either satisfied but no outcome. You can pamper the patients, you can give him the highest costly medications. He goes to the doctor and he loves the doctor because he prescribes for him a ton of medications. He goes out, he's happy, he have a glossy product, he's satisfied for the time being, however, no outcomes. On the long term, he would not be satisfied. The decision usually is imposed, and he is passive. So how we can do it through pharma? So it goes in two steps. First of all, it's about the information. Second is about the motivation of the patient. Third is to give him the tools in order to manage his health effectively. And then to provide him with an environment that is supportive, that can make him realize that value and actualize it in real terms, in terms of an outcome and satisfaction on the long term. So again, to the Institute of Medicine. So usually, they are enforcing first of all, we have to make the patient side with us. Second, we have to raise their expectations in order to ask for more, and then to demand the process to reach that care decision, to be communicated in the language that is understandable to the patients. So are the physicians the right intermediates for information transmission to patients? Here the question comes. When we know that most of the clinical visits doesn't go beyond 15, 30 minutes maximum. So what kind of information that the doctor can give to the patient? So here comes the role of pharma companies in information provision. So whether the information is about the product itself, whether the information is about the disease, whether the information is about the safety and labeling updates, whether it's about potential medication errors, or terms of efficacy in terms of patient-relevant outcomes. And this is a very important thing. When I speak about efficacy in terms that the patients care for, or feel that they are relevant to his case, and every patient has a different scope. A mother is looking for another kind of outcomes than is a professor in the university. When I tell someone, you're gonna have this medication, your life will be extended, however your vision will be not fine and not impaired. Maybe a mother, a housewife wouldn't mind, however, someone who reads a lot, he would mind. So also should be situational, should be directed to the patient case. What are the channels? Either direct or indirect. Indirectly, this is what the pharma companies usually do. They go to the healthcare professionals, they detail them, they do lectures, whatever. To policy regulators, to policy makers, when we go to safety update and the regulator puts it on the web, or through support groups. However, the direct tools are also as important because it gives the responsibility to the patient himself to seek information and to be responsible for his health so he could be more engaged. And of course, there's a lot of tools that the pharma companies can utilize. However, the question, are the legal frameworks are there to support this? And where's the patient rights in this whole thing? So the patient seeks the information, whether we like it or not, he can go to any source. But who, more than pharma companies, who is regulated, who could be penalized for any deceiving information or exaggerating promise, or any kind of mislabeling or off-labeling other than the pharma companies themselves. And if the pharma companies are regulated to introduce medications to the market, why they are not regulated to introduce the knowledge as well that it comes with the product? So the pharma companies, they not only introduce the product, they come with the knowledge that comes around the product itself. And here is the value that we create. It's not about generic or molecule or a product that has a certain price. What is the value? What is the knowledge knowledge that comes with that product? Where is the pharmacovigilance that happens with it? Where is the updates? Where is the kind of education that you provide to the medical community in order to support the patient for the right use and for the proper use? So we don't want to talk about philosophy, we want to have to talk it as a practice. So if we empower patients, what we are looking for, maybe we can manage the disease. Maybe in disease management protocols, we can involve patients as well. You can have, the protocol should include some knowledge transmission to patients, or to enhance his quality of life, to prevent preventable problems. When you educate the patient about the product, he can immediately discover if anything wrong happens. If he is not knowing, he will not know. He will tell very late. Cost savings, of course, and most importantly, patient satisfaction. So when we introduce the knowledge to the patient, we have to have it in three ways. First of all, questions. So we have to provide the patient with the right questions to ask. If the patient goes to the doctor and he has cancer, and he will ask the doctor how much I will live, what the doctor will gonna answer him? However, if I tell the patient, ask the doctor, if you take this medication, what is your probability to extend your life? What would be your quality of life? What would be, in terms of question, if I give him the question tools, that he can answer the proper question that meets his needs for information. Second, it's the behavioral language. We should talk to the patient in behavioral. We have to ask him to list, to describe, to identify. Then you can have the storytelling through giving him examples of patients similar to him where he can relate. So patient empowerment could be used in reducing error. And this is one of the conceptual frameworks where the patients can reduce the patient error through information. Of course, we need to have the laws and regulations to enhance the patient engagement. So he can be more collaborative, he could be adherent to his medication, reporting. So if I go to the questions, for example, to provide the patient with the right questions to ask, you can have the AHRQ, for example, as one example, where they give 20 tips for the patient that can use to prevent medical errors. Of course, if I am a pharma company and I have a medication that is associated with certain contraindications or with certain kind of errors that are more probable in that medication because of the type of patients who are using that product, if I give this patient the right questions to ask that goes around his case, he would be more able to discover any medication error or any adverse event even before it's too late. Again, we talked about the information, how we can create the value early in the value chain while we are designing the clinical studies. Right now, more companies are involving patients when they design the clinical study, when they decide the endpoints. So if I have endpoint like lowering the cholesterol, I have another endpoint that the patient can understand, that can sense. If I have a cancer treatment that I need to do the protocol or I need to do the clinical study design for it, I will ask for those endpoints that are relevant to the patients, and I'm gonna use them. The patient-related outcomes, reported outcomes, everyone knows this. However, how much they are incorporated and how much they are reflected afterwards in the information that is delivered to the patient. There's a study out of 27 cancer products that were marketed in Germany. Only 4 products, SPCs, have something related to the patient reported outcomes. However, the others didn't describe these. So if the patient read the indications, for example, what did he understand properly? What does this mean for him? So this is what we call it value-based innovation. So the innovation that goes around value. And here comes the questions. Please, if I exceeded my time, how many minutes? 2 minutes? 1 minute. So I will not go into the measuring because the second half is about measuring the patient satisfaction out of pharma companies. However, I'm gonna just only have the idea of value-based innovation, where the innovation starts with thinking of value created to patients and goes around it. So this diagram describes the whole process, where I have only the core product. If I go to the pricing scheme, I'm actually pricing the core product. Am I rewarding the companies to add value that goes beyond the core product itself? Is the innovation rewarded when it's value-based? What is the incentives of the companies to go into more innovation and toward creating value to patients if these are not rewarded in terms of fair competition between companies? So the core product, then comes the design. When I go and I seek patient-relevant outcomes, I do the R&D, the patient-related reported outcomes. Then I go to the product, packaging, delivery, and distribution. If the product is available at different places, this is a value created to patient. If I provide the product with the ancillaries that are needed to administer that product efficiently and safely, also this is a service. This is a value created to patients. Product affordability, then the information, direct or indirect, and then spelling mistake feedback that should come from the patients right down to the development process itself. And for the patients, usually sense value differently than we do. I remember when I first worked with a pharma company that was just replacing their eye drops with an eye drop that doesn't irritate the eyes, that it's very, it's not it doesn't give burning sensation. The sales dropped down very, very sharply. And we were asking what happened. We had improved the product. When we went to the patient and we asked, apparently that the patients were looking at the burning sensation because it makes them feel that the product works. So the value for patients is something totally different about what we think. So that's why we have to include them. I will stop here. Also the social value, this is something that we need also to focus on. Thank you very much, and hopefully in the questions part we can answer the questions about the measuring. Thank you very much.
Nadia, thank you very much indeed. She's a lady after my own heart. The patient engagement with the process that Nadia explained is certainly gaining impetus in the current world that we are, not only pharmaceutical companies but other research organizations trying to involve patients at the very start of the development process. Hopefully those issues will come up in the question time I'm going to talk about. Now could I ask the other two presenters also come on the stage? We're going to take 10 minutes for questions. Who'd like to go first? Amber.
Thank you very much for very nice presentations. My name is Jasmine Kame from Canada, now living in Kuwait. Question is for pharmacist Nadia. I
I'm sorry, could you speak a bit louder, please?
Oh, I'm sorry. Can you hear me better now?
That's better now, yes.
Okay. My question is for pharmacist Nadia. I really appreciated your talk, and especially the hard work that's being done by industry to help support patients. So you were mentioning that the pharmaceutical industry are highly regulated. We feel this very much in Canada, US, and EU, perhaps a little bit less so in the Gulf countries. So with the ambition that you have to help patients, in the context of an area in the world where the reputation of pharmaceutical companies are not necessarily optimal, what are your thoughts about partnering with healthcare professionals that could actually help support your projects? I'm thinking, for example, of pharmacists that have more access to patients as opposed to physicians who may have a very short time with the patients, as we're saying. So what are your thoughts about working with pharmacists in this context?
We are working with pharmacists, we are working with healthcare professionals, of course, and even with nurses sometimes. The nurses that look after geriatrics or cancer, maybe they are the right channel of information and knowledge that goes to the patients. Of course, we have to work with them, and we have to incentivize them to teach and empower patients about the medication. However, as I had said, the patient comes in the center, and I have to work on raising his expectations for what he asks. If the patient doesn't ask for the level that he deserves, and if he is satisfied with the minimum, I will gonna improve. However, I will not reach the level that I am or we are all looking forward to attain. So it doesn't go without the patient information. Regarding the regulations and about being here and unregulated, this is not true. True and not true, to be fair. First of all, the international companies, they follow their own standards and their own ethics, as well as they also follow the laws of the countries that they come from. Because if an American company, for example, do something wrong in China, they will gonna pay a penalty in the States, in the same way as if they have done this in the States. In our region, there is strict regulations, and they are strict to the level that they prevent pharma companies from reaching out to patients. And of course, we have to have the legal framework in order to start to communicate with the patient. And this no communication with the patient should start at any level if there's no enough frameworks and enforcement as well. Right now, we are looking for enforcement of regulations on companies who promote to doctors. Do the regulatory authorities know what is going to the doctors? What off-label uses are being promoted? What off-label dosage is being promoted? Are all the safety information included in the information provided to doctors? Those questions should be under now scrutiny from the health authorities in order to assure patient safety at the end. But if I cannot do this, my first safety, let's say, assurance is the patient himself. If the patient has the information, he will not allow any doctor to misuse his trust. Believe me.
Thank you very much, Nadia. Please.
Thank you, Nadia, for a nice presentation, and thank you, Dr. Wazir. My name is Hani Ansar, Public Affairs Director from Sanofi. So my words now, it's not biased to what Nadia presented, but just I have a question to both of you for the value and the value of innovation. We had quite a discussion with Dr. Wazir yesterday during the lunch, and we were discussing the pricing and the value. Where to reach out one molecule in order to serve and secure the patient, as well as there is another arm for patient access. They are working in parallel, one to create molecule and the other arm to secure the access for patient. So this is great effort from the industry, but we don't see how regulator can see the industry as well. So this is my question, where the industry value or where the regulator can see the industry value in this aspect.
Okay, thank you very much. Who wants to go first?
I will ask Professor Awazir to have some part in the discussion.
Thank you. What when we talk about when we talk about you know, the value of the industry and the value of the product, the regulator, I think we can see the value of the industry. There's nobody questioning the value of pharmaceutical industry, their importance, and their what products coming to the market, and we know for sure that one of the innovations that really worth the value of the pharmaceuticals, because these are the products which we can see straight for their value, we can see their impact, the mortality for the patients. There's nobody arguing about that, and everybody, every country would love to support the pharmacy. What is the gap is a little bit of transparency. Because here you're talking about pricing. When you're talking about pricing, you need the transparency. Transparency from the companies and also transparency from regulators based on what they base their decision. From our perspective, for example, a lot of people, when we price a product, a lot of pharmaceutical companies, they come and complain. And then they go and say, you give us lower price of your product. And remember, we are using reference pricing. And if you look to the reference 30 countries, for example, in Saudi Arabia, 25% of those countries, we are referencing them, is having a higher GDP and economic status compared with Saudi Arabia. And only 5 countries is below Saudi Arabia. Now, if you take a decision, 100 decision, and you give the company 90% of that decision in favor, and you give them 5% as the favor, now you find the company is complaining that you are undervaluing us. I think you need always to look to the pictures and to look to the availability of the product. Because as you face the same value, I have a company, for example, which is denied patient warfarin because of the price. We have patient died because the company would not import the warfarin and the comedian at one point of time. Because the price at that time was 20 Saudi riyals, and suddenly the company asked for 120 Saudi riyals. And we negotiated, we didn't get the price. Now, just to see the value, because even sometimes the companies, they lose their values. So in order to this, it's always a balance between what companies is using and what the regulator is using. I always trying to defend that regulator and the company should be friends. They are not enemies. They should be friends all the time. Because this is a Catholic marriage. You cannot get divorce. You have to work. You have to work together in order to serve the patient. Because at the end, we are responsible for serving the patient, and you are responsible for the patient. We have a very straight aim to achieve that. The only thing is the transparency on what you can do and what you can do. Remember, there is always rules controlling you as an industry. There is a rule controlling me as a regulator. Then we have to find a way that we can meet at the mid of the streets.
Thank you very much. Of course, the big question is that are the regulators the right people to actually ascertain the value? Now, my question to Wazir is that now that we see, as he explained, quite a lot of harmonization in the price of GCC, is it the time to have a single HTA agency in the GCC region, the same as the centralized procedure for regulatory and marketing authorization?
Yes, Professor, I did